Welcome to Health Focus, where we focus on your health. Today we're focusing on cosmetic dermatology, which is a really important subject for our sense of self-esteem and our overall health. I'm your host, Dr. Scott Anderson, and it's a pleasure to welcome to the set Dr. Serena Miraz. Thank you so much.
Thank you so much, Scott. Happy to be here today.
It's just a pleasure, Serena, and I know you're a Stanford-trained dermatologist.
Yes.
So you've had superb training. I believe you also went to Tufts Medical School.
Yes, I did.
And how did you end up gravitating towards cosmetic dermatology? And tell us just a little bit about what the term even means, because obviously dermatology we know a bit about. We've done a show on skin cancer, for example, with one of your colleagues, John Geis. But what is cosmetic dermatology?
That's a great question. So cosmetic dermatology is really a subset of what we do in dermatology. So the dermatologic field is very wide. I would call it even vast. And there's a lot of subspecialists ranging from pediatric dermatologists to Mohs surgeons, which my colleague John Geis talked to you a little bit about. Some specialize more in infectious disease. Dermatology really encompasses a great breadth of medicine. Cosmetic dermatology really is a focus on health, beauty, and wellness. That's how I see it. So cosmetic dermatology is a field where we help to kind of beautify, I would say, and really make a person kind of on the surface. And I like to extend that to internally the best version of themselves. So beauty and health have a lot of overlap, and it's really about focusing on health and wellness and what we deem in our society as beautiful.
And I think you probably approach that in a very holistic manner, because I'm aware that you're board certified also in internal medicine.
That's correct.
And obviously internal issues like having problems with your heart, your kidneys, your internal organs, that can affect your systemic health, and I imagine it can affect your skin quite a bit.
Absolutely. The skin just happens to be the most visible organ, but it is indeed an organ. It's a complex organ. It acts as a barrier to the outside world, but it's also an important immune function organ. And it has a lot of, it's susceptible to a lot of the insults internally that we see, say, with elastin or collagen breakdown. Things that are destructive to our arteries. Actually, the arteries have a lot of elastin. That's that elastic material that makes them expand and bounce back. Our skin has that also. So things that are destroying things like our arteries are also destroying the ability of the skin to bounce back. So there's a lot of overlap with internal disease with the skin. So it just happens to be the most visible. So we don't need a lot of special tests and devices to really examine it, which makes it a little easier to assess the patient.
Before we get into some of the treatment modalities that you might have at your disposal, Serena, I wonder if you might just explain to us how we can maintain our cosmetic appearance starting really in childhood. What can we do to keep our skin in top shape as we go into our teenage years, 20s, 30s, and beyond then? What steps can be taken to keep your skin healthy?
It's a great question. So first and foremost, internal health actually will help with skin health. And that encompasses not just general things that we think about, but it certainly does encompass general things that we think about. For instance, diet, getting enough sleep, don't smoke, don't drink too much, and exercise adequately. But also things like social connections. I'm kind of I've become an anti-dermatologist. I tell people to get outside every day because I think that's super important. I don't tell them to get excessive sun because that does damage the skin. But things that make us healthy internally make our skin healthy. So there is nothing that we can do. I have no tools that will really overcome really bad lifestyle habits. Those eventually will catch up. Starting during childhood is ideal, but it's never too late to start. it's never too late to start. I would just recommend starting earlier versus later. There's less catch-up to do.
Right. Is it fair to say that, if there's one thing, I guess one might argue it could be smoking as well, but if there's one thing that really we need to think about, it's the ultraviolet exposure, right? UVA and UVB. So starting in childhood, I know our kids were swimmers, and we tried to persuade them to use sunscreen and to protect themselves by staying under parasols and using clothing that protected their skin, and we had some success. But back when I was growing up in the 1960s and 70s, that wasn't part of the mentality. So, that's one of the key things, isn't it?
It really is. So the sun induces the formation of some proteins, actually, that very effectively break down our collagen and our elastin in our skin. There are other things that do that, like a lot of the chemicals that are excreted with smoking that go into our skin. Pollutants do that as well. And then some of the food that we eat. So there's something called advanced glycation end products, and advanced glycation end products are very reactive species that occur, really, they form from high dry heat with cooking. So unfortunately, that delicious char on the barbecued food is really damaging to our skin. So this is something that's been kind of more recently examined. All of these things will induce the formation of what's called metalloproteinases, and those are proteins that very effectively, like I said, will break down collagen, elastin, a lot of the structure of the skin, and accelerate aging changes like wrinkles and like uneven pigmentation. So a lot of the sun is classic, but there are so many other things that will contribute to aging, and aging poorly, aging well or aging poorly. So it's always a balance.
So we've discussed sun exposure. You mentioned smoking, which I think is terribly
Yes.
important. I think you mentioned collagen in conjunction with that.
Yes.
And what does it really do? It causes wrinkling of the skin and premature aging, right?
Yes, but it's more than that. We've discovered that with the aging process, we accumulate cells that are called senescent cells. And the senescent cells they're not functional, but they're not dead. So they're also referred to as zombie cells. So they're very inflammatory, and they actually, having senescent cells makes us have more senescent cells, which is one of the reasons that aging is not linear. It's more kind of asymptotic. So it's kind of curvilinear is what I would say. No, those are fancy words, sorry to use those, but these senescent cells are actually very damaging, and they not only create wrinkles, but dullness of the skin and lack of health. They also affect the immune function of the skin. So we're understanding, we've always known that immune function of the skin is very important, but we're understanding that the skin actually contains this whole microbiome, just like the gut does. So all these microbes that live in our gut, they also live on our skin. They actually extend off of us about 3 feet. And they help our immune function. They actually direct our immune function. So the two things that really drive aging and demise are basically getting kind of frail, what we call sarcopenic, which relates to frailty, bones end up breaking, we have no balance, and I say you get too thin, too weak, you fall, you break, you die. That's not good. But the other big thing is immune dysfunction. So the immune system is so important, because when the immune system is going a little awry with aging, we get a lot of inflammation that drives a lot of unwanted disease processes, like autoimmune disease, like heart disease, like cancers, like neurodegenerative diseases such as Alzheimer's and Parkinson's. And so we really want to keep our immune system healthy and intact, and the best way to do that is to keep our microbiome intact. And so that's taking care of our skin, it's taking care of our gut, And it's taking care of ourselves with lifestyle factors that actually keep our microbiome happy.
Well, let's shift gears a bit now that you've explained that, from prevention to your assessment and treatment. What do you do when someone comes in? How do you approach assessing an individual person, and what modalities do you employ?
Yes. Well, first off, I like to find out the patient's motivation, so why the patient has come to see me, and what they would like to achieve. And often I can help direct the direction of where we are going. Now, usually this fix or preventative treatments are not just one thing. So again, it's hard to age, and we need to do a lot of things with this aging process to do it in the best way possible. So it does include things that will help with regeneration of skin as we age. What happens is in early, up to about 35, we're very efficient at regenerating skin, which is why the skin continues to look great. After age 35, what happens is degeneration starts to take over, and this will accelerate with unhealthy lifestyle factors and things like too much sun, smoking, etc. Genetics play a role, the microbiome plays a role. All these things play a significant role. And like I said, this isn't linear. It kind of goes in leaps and bounds for the most part. So what we want to do is slow down the degeneration and ramp up regeneration. And we have a lot of tools that can help with that. But we want to minimize things that will drive an accelerated downward spiral for sure.
Getting a little beyond the wellness, nutrition, microbiome, may I ask you about a few other specific modalities?
Absolutely.
What topical agents do you use? I understand you use some topical agents, and even on occasion perhaps surgical interventions. I'm not sure.
Oh, absolutely. So what I use personally is pretty vast. I have my bathroom counter has a lot of products, and I think it is important to take care of our skin. I know it's important. There are studies that support that it is important. We want to combat a lot of the reactive oxygen species that form just from living. We want to help with this regenerative process, and we want to keep the skin barrier intact and healthy. And that actually, there's data to show that that actually helps internally as well. So we're not only looking better, we're actually making ourselves healthier on the inside by treating from the outside. So I think that things like, starting with obviously mild cleansers, things that are not going to strip out lipids, the mortar between the bricks, so to speak, in the skin, important. Starting with moisturizers, starting with things that will stimulate those fibroblasts, which are the cells in the skin that will pump out the collagen, elastin, and what we call the ground substance or hyaluronic acid, and other what we call glycosaminoglycans in the skin. So those are all very important components of a healthy, intact skin. The fibroblasts, these cells that make these important structures, tend to slow down with the aging process. So we can help stimulate them beginning with skincare products, with diet, with a number of things. But skincare products are, they're very helpful in helping to regenerate and clean up a lot of the garbage that's going on, really, that we can't even see on a day-to-day basis. So things like antioxidants, vitamin C is a classic, is important, and things like peptides will help to stimulate the certain peptides. There are thousands of peptides out there, but there are skin-specific peptides that are very helpful. Sun protection, not only with sunblock, but with protective clothing is important. Like I said, it's important to go outside. Early morning is great, especially saying morning sunlight, but sometimes midday we need to be out, there are activities, etc. I don't recommend that people sit in front of their computers all day. That's just as unhealthy as going out in the sun. So there are ways that we can go outside safely with sun protection. I'm a huge fan of retinoids, things like tretinoin, which is a long-term mainstay in dermatology. That is a carotenoid. That's something that will help to, again, stimulate regeneration of the skin. And new on the market, there are some topical exosome products, and exosomes are these basically cell messages that are very effective at helping to regenerate and renew and clean up some of those bad zombie cells that I was talking about.
What is dermabrasion and when do you use it?
Yeah, so dermabrasion is, it's basically sanding down the skin. There is something called microdermabrasion, and that is a very light sloughing of the top dead layer of the skin, something called the keratin layer. That is done frequently. Heavier dermabrasion, which I did often when I was in training, it's not done as commonly anymore. And we sometimes do that to help smooth out divots in the skin, for instance, after surgery. But for the most part, we have kind of fancier tools that have fewer side effects and people get a faster healing in this day and age. So there's a lot of progress in technology that has really shifted our options of tools in the toolbox that we can use.
Is there a role for botulinum injection?
Oh, absolutely. Absolutely.
Okay.
So what we call neuromodulators, became very popular in dermatology in the late 1990s. And a husband-wife couple, Jean and Alistair Carruthers, who are up in Canada, husband and wife, he's a dermatologist and she is an ophthalmologist. And they discovered, really through serendipity, which is how so much of medicine comes about, just luck, right? She was actually using botulinum toxin for medical purposes, for basically what we call blepharospasm, which means just this uncontrolled quivering of the eyelid. And there were patients that were very debilitated or troubled by this that were being treated. And a lot of them actually had some injections in areas of muscles that made people look mean or angry or tired. And a lot of these patients came back and said, "Oh, doc, I'm getting compliments. People say I look more rested, I look fresher, I don't look so mean, blah, blah, blah." So she talked to her husband about this. They ended up trying this on a few people just to get rid of these kind of angry lines, and then presented at the American Academy of Dermatology meeting in the late 90s. And the rest is history. People kind of thought, oh, this will never catch on. Well, guess what? There are hundreds of millions of people around the world who have received treatment for cosmesis and also continue to receive it for other medical indications. There are a lot of medical indications. In fact, there are more medical indications than there are cosmetic, but we see a lot of that, yes.
And I guess also it's important to realize that there may be some geographic or population-based differences in terms of what people present with. For example, people who have more darkly pigmented skin may be more prone to things like systemic lupus, discoid lupus, things of that nature. So I guess you have to be sensitive to these issues, and similarly people with lightly pigmented skin may be more prone to skin cancer, although certainly not exclusively. So you must have to have quite a few tools in your armamentarium to tailor your treatment to the patient population.
Absolutely. That is absolutely true. So there are susceptibilities that are more common depending on where somebody's ancestors came from. What we do see in California is the full range of people whose ancestors came from all over the world. And we see a lot of people whose ancestors have come from many parts of the world. So there's a lot of what I would say mixed demographics, and which makes things a lot of fun.
Sure. In a related vein, what percentage of your patients roughly are women versus men? Because I realize times change, but I have the impression that when you have multiple skincare products and multiple interventions, that most men would not want that, but it would be more popular among women. But perhaps that's an old-fashioned perception.
Well, I would say that it's still more common for women to come in than men, but I have a lot of male patients, and that demographic is growing tremendously. So what I do say is that, I'm happy that men are taking care of themselves because we women are looking at them and they're our partners and other things like that. But it still tends to be more than 50% of the patients coming in are women, but more and more men are coming in. There is what we call ageism that's out there. So consciously or subconsciously, a lot of times when people, for instance, are interviewing for a job, if they look old, the interviewer may think they're tired, that they don't have the energy necessarily to do the job. So there may be some unconscious biases. And there's also just general awareness of the fact that it's taking care of ourselves, it's self-respect, it is something, why not be the best version of ourselves at every age? When we now have great tools that we can do this with.
Right, and you're raising an issue there too that relates to the broader culture that we live in.
Yes.
And I think particularly in Western industrialized societies, there is a kind of tendency to reify and worship youth. And we see that also in the movie industry and advertising industry. I guess there may be other cultures, more traditional cultures, that have a tendency to sort of reify and look up to the elderly. So I guess there is a cultural component to that. But I certainly, as somebody who practices geriatrics myself, I think there definitely is ageism. And to the extent that you can look younger, it does help you in the economy and in terms of opportunities. I think that's true.
I mean, additionally, I would say that when we look in the mirror and see ourselves as a younger version of ourselves, we feel younger and we kind of act younger also. There is this kind of feedback that occurs just within our own persona, I would say.
Recognizing that, is there an educational process to this also in terms of controlling expectations? Because I mean, the fact is that as we live to older and older ages, we're going to have some changes in our appearance. Do people come to you with unrealistic expectations? I guess I'm asking a kind of provocative question there.
Yeah, no, absolutely. So I would say, I'm fortunate the majority of my patients have realistic expectations, and I do certainly try to educate people before doing anything that if you are a 55-year-old, we're not trying to make you look like a 25-year-old. That's just, we just want to make you look like a fresh, good 55-year-old. So that is important. We do see examples on all kinds of media, I would say, of maybe the other side of things where the older person is trying to look like the teenager or the 20-year-old. And that in this day and age, I think, is not that realistic, and it often backfires, and in some cases makes people look almost worse or maybe a little ridiculous.
I think that's also true for cosmetic dentistry and for plastic surgery, that having a more modest goal seems to work better.
Yes.
Do you refer to plastic surgeons from time to time?
Oh, absolutely.
Okay. Yes. Our time is running a little bit short, but as we begin to close out, I know I'm enjoying it a lot, but just a couple closing questions as we begin to run short on time. How about ongoing research and future developments? In your field as a cosmetic dermatologist, Serena, what do you see in the future?
Yeah. So I would say what is happening right now, and which that will just continue to increase and become just a much bigger part of this industry, is regenerative, what we call regenerative medicine. So I was saying that, 60-year-old who's trying to look 20 looks a little silly when they have a bunch of hyaluronic acid pumped in their face, for instance. But when we can take that 60-year-old and regenerate cells to make him or her look his or her best, I think it's so much more attractive, And it's not only attractive, but it's healthier. Generally, with this attractiveness comes a health component. So I think we're understanding that health and beauty are very intertwined.
Right.
In fact, I think we were evolved to see beauty because healthy things, basically are beautiful, and they actually are good for the future generations if you pick
Right.
a healthy mate, I guess. So these two things are you can't separate them. And
Right.
regeneration with things like stem cells, with exosomes,
Okay.
with a lot of products that will kind of turn on the genes and modify what's called the epigenome. The epigenome is something that's above the genes that helps with expression of some genes and not others. So these are all super exciting areas of medicine in general, but certainly
Definitely.
in cosmetic medicine, yeah.
Definitely exciting, and I think also we're in kind of uncharted territory, because one of the things that I think has been well described is that historically the human lifespan was quite a bit shorter. The maximum lifespan has always been about the same. There seems to be a wall at about 110, 115 years of age where people rarely get beyond it. But in the year 1900, the turn of the last century, the average lifespan was only 49 years, and people succumbed to infectious diseases like influenza and pneumonia. So having people who live beyond their reproductive years into these advanced ages is new. It's new territory for all of us, isn't it?
It's fairly new, the goal, I think, of most of us at this point is not to live to necessarily 140, but to have really good quality of life up to the end. So to have long enough life and to be healthy and vivacious, to be mentally intact,
Yes.
to be physically intact, to feel and look our best before we check out. at the
That's
end.
fantastic. And Serena, thank you for answering such difficult and challenging questions. If people wish to get in touch with you, perhaps they can go to your website or...
Yes. So I practice at Solano Dermatology Associates, and we have 5 office locations here in Vallejo, in Fairfield. I also work out of our St. Helena office. We have a Napa office and a Vacaville office as well.
Well, as I said at the beginning, we've had at least 2 dermatologists from your group here, Dr.
Yes.
John Geis and you, and both of you have been excellent, and seeing things from your perspective really puts a whole new light on dermatology. Thank you so much for taking the time to join us, and good luck in your future endeavors. Perhaps you'll visit us again.
Oh, truly my pleasure. It's been a lot of fun, Scott. I really appreciate the opportunity. Thank you so much.
Pleasure for us. Remember, here at Health Focus, we focus on your health. Today we've been focusing on cosmetic dermatology, and I think the lesson I've learned is that there are many tools at our disposal, including prevention and a healthy lifestyle. And we all wish you the best of health as you try to stay healthy. See you next time.